Have you ever felt something unusual in your body and wondered, could this be serious? Today, we're going to talk about something every senior should pay attention to, the signs our body gives us when danger is near. I know the title sounds frightening. This sign in your body means death is coming soon. But before you panic, understand this: our bodies are like an alarm system. If we learn to recognize these warning signs early, we can take action, sometimes even prevent serious consequences. Knowledge is power, and being aware can literally save your life. Our bodies speak to us in ways that we often overlook. Sometimes it's a minor discomfort in a joint, a sudden weakness in our legs, or even a small change in our mood. These may seem insignificant at first glance, but they can be our body's way of sending urgent messages. For seniors, this is even more critical because as we age, our bodies naturally become more fragile and warning signs may appear faster and more intensely. Many people think that feeling tired or having minor aches is just part of aging, but that's not always the case. These subtle signs are often the earliest indicators of serious underlying health issues. Paying attention to them isn't about creating fear, it's about awareness and preparedness. Understanding the signals your body sends allows you to act early, seek help, and potentially prevent life-threatening complications. The first warning sign is persistent chest discomfort. It's something many of us tend to ignore, assuming that it's just stress, indigestion, or the result of overexertion. But when discomfort or tightness in the chest persists or keeps returning, it's a signal that should never be taken lightly. Seniors are particularly at risk because heart problems often present differently with age. You might not experience the dramatic chest pain that younger people do. Instead, you may notice a subtle pressure, heaviness, or burning sensation in your chest that comes and goes. Some people even experience it in the shoulders, jaw, or arms. This is your heart's way of telling you it's under strain. Recognizing these signals and seeking medical attention early can make all the difference. Heart disease remains one of the leading causes of death in seniors, but timely intervention often prevents tragic outcomes. Chest discomfort can also be accompanied by other signs such as nausea, sweating, or lightheadedness. Seniors often dismiss these as minor inconveniences, yet together these symptoms could indicate a heart attack in progress. It's important to remember that every person's experience is unique. Listening to your body, noting the frequency and intensity of discomfort, and informing your doctor promptly is a crucial step in maintaining longevity. A simple early checkup can often prevent severe heart complications, and in many cases, it can save your life. The second warning sign is shortness of breath that comes on suddenly. Shortness of breath, or dyspnea, may appear during physical activity in normal circumstances, but sudden or severe breathlessness, especially at rest, is never normal. Seniors must pay close attention to this symptom because it may indicate heart failure, lung disease, or even a blood clot. Sometimes the body struggles to get enough oxygen, and this becomes evident through gasping, shallow breathing, or an overwhelming sense of fatigue after minimal effort. Even simple tasks such as climbing stairs, walking a short distance, or carrying groceries can trigger this warning. Ignoring it can be dangerous because it often signals that the heart and lungs are under severe stress. Many seniors attempt to rationalize the shortness of breath, attributing it to aging or a lack of fitness. But it's important to remember that sudden breathing difficulties are never a normal part of aging. They're your body's way of signaling that vital organs are struggling. By monitoring your breathing patterns, noting any changes, and consulting a doctor promptly, you take a critical step toward preventing serious complications. Pulmonary embolism, congestive heart failure, and chronic obstructive pulmonary disease (COPD) are examples of conditions where early detection can significantly improve outcomes. The third warning sign is extreme and unexplained fatigue. Fatigue is often brushed off as a normal aspect of getting older, but there is a difference between ordinary tiredness and the kind of exhaustion that doesn't go away, even after proper rest. Seniors may notice a sudden inability to complete daily activities, a lack of energy to socialize, or feeling physically drained after routine tasks. This type of fatigue can indicate serious issues such as anemia, heart disease, thyroid problems, infections, or even cancer. The body requires energy to maintain essential functions, and when fatigue is extreme and unexplained, it signals that something is interfering with these basic processes. Chronic fatigue can also affect emotional and mental health. Seniors experiencing this may feel irritable, anxious, or depressed, which can create a vicious cycle of worsening health. By taking note of persistent tiredness and seeking professional advice, seniors can uncover hidden health problems before they become life-threatening. Medical evaluations, blood tests, and lifestyle adjustments often reveal the root cause, allowing targeted treatment and renewed energy levels. Fatigue is not just about feeling sleepy, it's a critical indicator that the body needs help, and recognizing it early can be life-saving. Number 4 is sudden confusion or memory problems. Forgetting a name occasionally is normal, but abrupt confusion, disorientation, or difficulty recognizing familiar people or places is a serious warning. Seniors may experience moments of being lost in their own home or forgetting basic routines, which can indicate a dangerous decline in brain function. Causes may range from strokes and infections to oxygen deprivation or metabolic imbalances. Sudden cognitive changes can appear overnight and often require immediate medical attention. It's important for families and caregivers to notice subtle shifts in behavior, such as repetitive questions, misplacing items frequently, or a decline in decision-making abilities. While some cognitive decline is part of aging, rapid changes are not normal and may be reversible if addressed promptly. Hospitals and clinics often conduct tests to determine whether these symptoms are caused by treatable conditions such as infections, medication side effects, or vitamin deficiencies. Recognizing sudden confusion is not just about mental sharpness. It's about identifying potentially life-threatening medical issues. Fifth, changes in appetite or rapid weight loss without trying are particularly concerning. Seniors may notice that food no longer appeals to them, meals are skipped unintentionally, or body weight drops dramatically within weeks or months. While minor appetite changes can happen naturally, sudden or extreme changes often indicate underlying health problems. Digestive disorders, infections, hormonal imbalances, or even cancers can manifest first as reduced appetite or unexplained weight loss. Weight loss also affects the immune system and energy levels. A body deprived of adequate nutrition becomes weaker, making seniors more susceptible to illness and injury. Monitoring eating habits, keeping track of weight fluctuations, and discussing sudden changes with a healthcare provider are crucial steps in early detection. In many cases, early intervention allows treatment of underlying conditions before they escalate into severe complications. Maintaining proper nutrition, hydration, and a balanced diet plays a key role in sustaining overall health and resilience in older adults. The sixth sign is persistent pain or swelling in the legs and feet. Many seniors dismiss swelling as a normal part of aging or attribute it to sitting too long, but it can indicate severe problems with circulation, blood clots, or heart failure. Painful swelling, especially when accompanied by redness, warmth, or tenderness, should never be ignored. The body is signaling that blood flow is impaired, and this can escalate into dangerous conditions if left untreated. Venous insufficiency, deep vein thrombosis, and congestive heart failure are among the conditions that manifest through leg and foot swelling. Early recognition and treatment can prevent serious complications, including strokes, heart attacks, or pulmonary embolism. Seniors should monitor for changes in skin texture, warmth, and color, as these are additional indicators that circulation may be compromised. Elevating the legs, wearing compression stockings, and seeking medical evaluation promptly can save lives. Finally, the seventh sign is changes in skin color or temperature. Our skin reflects internal health, and sudden changes in color, temperature, or texture can be serious warning signs. Pale or bluish skin may indicate oxygen deprivation, cold extremities may point to poor circulation, and red or inflamed areas could signal infections or other systemic issues. Seniors should pay attention to any unusual bruising, rashes, or persistent discoloration, as these may signal problems with the heart, liver, kidneys, or immune system. Skin changes often appear alongside other warning signs, such as fatigue or swelling, reinforcing the urgency of a medical checkup. Seniors and caregivers should be proactive, documenting changes, comparing both sides of the body for differences, and seeking advice promptly. A timely response can prevent complications from becoming life-threatening. Understanding the messages our skin sends us is an essential part of listening to our bodies and preserving health in later years. Recognizing these 7 warning signs is not meant to frighten you. Instead, it empowers you to take action. Seniors, your body is always communicating, and paying attention can give you precious time to seek help, treat issues early, and improve your quality of life. Ignoring these signs can be dangerous, but awareness and timely medical attention can literally make the difference between life and death, so stay alert, listen to your body. Don't dismiss pain, confusion, or unusual changes as just part of getting old. Each warning sign is a message, sometimes urgent, sometimes subtle, telling you that it's time to act. Share this knowledge with your friends and family too, because awareness can save lives. Remember, your body is speaking. Are you listening?